Hello and welcome to this video in the Anatomy of a Submission series, and today we're going to be talking about the Kimura. In this series of videos, I explain exactly what's going on in the body physiologically with the various BJJ submissions, so you can have a better idea of what's going on, make a more informed decision on when you might want to tap, and perhaps use the information to be able to put on the submission a little bit more effectively. So the Kimura, this is a pretty versatile submission that most of us know. It can be used from side control, from guard, sometimes as a counter to a takedown or perhaps a guard pass attempt. I'm sure there are many ways people who are better at BJJ than me can utilize this submission. But I'm here to talk about the anatomy of the submission, what is actually going on when this submission is applied. So this submission is pretty basic. It puts the shoulder into a forced internal rotation. So the shoulder has various movements. It can do flexion, extension, abduction, adduction, and external rotation and internal rotation. So if I, sort of put myself into shoulder internal rotation, you can see I'm sort of starting to put myself into a bit of a Kimura position. So the first question that most somewhat morbid people like to ask is, what if I didn't tap? What if I got put in a Kimura and they just kept on going? So excessive internal rotation of the shoulder will narrow the space between the head of the humerus, which is just the top of the upper arm, and the acromion, which is a bit of a bone that comes off the scapula. This can cause a bit of a painful impingement, which most of us have felt at one time or other. I know I certainly have. If you then kept on going, a rotator cuff tear is very possible, and I would say at this point quite likely. If you then kept on going with the internal rotation of the shoulder, it's possible you would escalate to a tear of the labrum, which is the ring of cartilage that sits in the shoulder socket. And then finally, a shoulder dislocation would likely result. This is where the head of the humerus, the upper arm bone, completely comes out of its socket. Now, I'm at the moment only a blue belt in BJJ, so I'm not here to give a class or advice on how to apply the Kimura. You're best off getting that information from someone more experienced than me. However, anatomically speaking, the shoulder will be at its most stressed position when it is both internally rotated and extended. So if you are putting on this submission, the more you can get the arm back and away from the body, the tighter the submission will likely be. What I notice in my clinic, and what's really interesting to me about shoulder internal rotation, is that it can become extremely limited quite easily. The simplest way I do this in clinic is to get someone to put their arm behind their back and try to touch their opposite shoulder blade. And it's really not uncommon for someone to try this and only really be able to touch their sacrum, the bottom of their lower back. And these people often struggle with very simple day-to-day tasks like putting on a jacket, things like that. In terms of BJJ practice, if you are limited in shoulder internal rotation, which a lot of people are, you're going to be really easy to get with the Kimura submission. So your margin of error is going to be really, really small. Fortunately, shoulder mobility can be improved upon. And if you need any help learning how to do this, you can watch the videos in my shoulder exercises playlist on this channel. Or if you would like some specific help and advice, you can get in touch at matsidemaintenance@gmail.com, and I can offer you some specific tailored rehabilitation exercises. I hope you found that information useful. If you have any other submissions you'd like me to cover in this series, please leave them in the comments below. I'm here to help you train harder for longer and, importantly, as pain-free as possible.